Welcome, everyone. Thank you for joining us today. I'm Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's program is part of our Nutrition During Cancer Treatment Education Series, a special collaboration between the Blum Center and Mass General Brigham Cancer Institute. Before we get started, I just want to go a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you're in listen-only mode. Everyone has been used. We hear our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the bottom of your screen. You have time for in the end. Only Blum Center staff and our guest speakers will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to complete. Your feedback is important to us as we plan future programs. All right, so next I'm going to turn it over to Rob Dunn, who will get started.
Awesome. Thank you, Amy. And to everyone who's attending, Happy New Year. Thank you for being here. I am happy to introduce our primary speaker today, Martha Silva. Martha is a dietitian on our Cancer Institute nutrition team and has spent a lot of time putting together these seminars to walk through some of the aspects of remaining well-nourished during cancer treatment. I'll be here monitoring the chat, so please enter any questions that you might have, and we'll be happy to tackle those at the end. So without further ado, here's Martha.
Awesome. Thank you, Rob. Let me just share my slides with you all. Is that showing up on your end, Rob?
Looks good.
Okay, perfect. Welcome, everyone. Again, as stated, today we're going to discuss some strategies to help manage difficulty swallowing during cancer treatment. Here is our agenda. I'll start by giving a brief overview of nutrition during cancer care, and then we'll get into difficulty swallowing, including some dietary approaches to management, other interventions, and a few practical tips and tricks to wrap up. Nutrition in cancer care. Our team of registered dietitians works with patients, their families, and their oncologists to manage the side effects of treatment, including difficulty swallowing, develop individualized diet and hydration plans, recommend oral nutrition supplements, prevent, identify, and treat malnutrition, guide tube feeding support as needed, and counsel on nutrition for wellness and survivorship. Difficulty swallowing. The swallowing process is a complex action that relies on more than 30 nerves and muscles. The path of solid food and liquids from the mouth to the stomach occurs in 3 main stages: oral, pharyngeal, and esophageal. This illustration shows a light blue food bolus as it travels through each stage. So first, during the oral stage, the bolus moves from the mouth to the pharynx, also known as the throat. That's the muscular tube behind the nose and mouth that leads into both the esophagus and the lungs. Next, in this middle graphic, the pharyngeal phase, the bolus is going to move through the pharynx and upper esophageal sphincter to the esophagus. There are also a few mechanisms that protect the airway during this phase to prevent what's known as aspiration. This is the entry of food or liquid into the lungs. And then finally, during the esophageal phase, food is going to travel through the esophagus and into the stomach by way of peristalsis, which is an involuntary wave-like muscle contraction. From start to finish, the entire swallow process typically takes less than 10 seconds. And for most people, it doesn't require too much thought or effort. It's often something that occurs quite naturally. Cancer and its treatment can complicate the swallow process, and they're associated with several risk factors for dysphagia, which is the clinical term for difficulty swallowing. First, tumor location, particularly tumors that impact the pharynx, tongue, or esophagus might obstruct the swallow process. Second, any sort of surgical resection affecting the muscles or nerves involved in normal swallow function might pose a challenge. And then chemoradiation to the head and neck is a major risk factor for difficulty swallowing that we often encounter here in the cancer center. Some acute complications of this regimen may include mucositis or mouth sores, edema, pain, thick saliva, hyposalivation or lack of saliva, infection, and dysgeusia or change in taste. Chronic complications of this regimen may include reduced capillary flow, tissue atrophy or necrosis, tissue death, neuromuscular fibrosis, which is the hardening of tissue, hyposalivation, and infection. And then finally, radiation to the esophagus may cause inflammation that can contribute to painful or difficult swallowing. For dietitians, difficulty swallowing is a concern because it may contribute to aspiration and pneumonia, weight loss, nutrient insufficiencies and deficiencies, dehydration, malnutrition, and decreased resistance to infection. What does difficulty swallowing look like for patients? People may experience coughing or choking while eating or drinking, the feeling that food is getting stuck at some point along the way down from mouth to stomach, pain, a lack of interest in food, a decrease in typical portion sizes, and finally a need for texture modification, as certain foods may be a bit easier to get down. Speech-language pathologists, or SLPs, are the experts who evaluate and manage dysphagia. Evaluation may involve a modified barium swallow exam, where the provider takes an X-ray while the patient consumes food or liquid that's mixed with barium in order to visualize the swallowing process. A fiber optic endoscopic evaluation of swallowing, where the provider guides an endoscope with a camera down the throat while the patient eats and drinks, may also be used to visualize the swallowing process and identify any potential issues. Based on the SLP evaluation, rehabilitation may include exercises to stretch or strengthen swallow muscles, new strategies to make swallowing easier, and modified food textures or consistencies. That's where dietitians come into the picture. We can help patients meet their nutrition needs based on the recommendations from SLP. So we're really going to be taking the guidelines that SLP provides from that evaluation and figuring out what does the patient like to eat and what can they ideally eat to keep their weight stable and feel well. The International Dysphagia Diet Standardization Initiative is a global diet terminology for texture-modified foods and thickened liquids. Drinks are levels 0 through 4, and foods are levels 3 through 7. For food, level 7 is a regular diet without any restrictions. Level 6 is soft and bite-sized, such as soft fish that breaks into pieces or soft chopped fruit. Level 5 is minced and moist, such as finely minced meat in a sauce or gravy for that moisture, or well-cooked, finely mashed vegetables. Level 4 is a pureed diet. So that's going to include any foods that are smooth, they do not require chewing, and they're going to hold their shape on a spoon. And then level 3 is liquidized. For drinks, level 0 is thin liquids like water. These liquids move very quickly when swallowed. So if someone is having challenges, they can be a little difficult to handle. And that's where SLP may suggest thickening liquids to make them a bit easier to control. Level 1 is slightly thick, the consistency of fruit nectar. Level 2 is going to be mildly thick, like a milkshake. Level 3 is moderately thick. These are going to be liquids that require a wide straw with some effort to pull them up the straw, or could even be consumed on a spoon. And then level 4 is extremely thick liquids that require a spoon, and that some people may not think of as a liquid, things like a pudding or a custard. If indicated, the SLP evaluation will include a diet order that the dietitian will then work with. So for example, regular solids and thin liquids could be a diet order, pureed solids, slightly thick liquids, etc. Texture modification may also be necessary even without a formal SLP evaluation. For example, if the primary barrier to swallowing is due to pain, perhaps there are some mouth sores present during chemo or inflammation from radiation. In that case, soft foods may be easier to tolerate. So a patient who can safely swallow regular textures like cereal may prefer to avoid coarse and crunchy foods in that acute window and opt for something like a cream of wheat or oatmeal. And on a similar principle, chicken salad might be easier to get down than a chicken breast. The primary barrier is dryness, perhaps due to lack of saliva. Moisture can help form a more cohesive food bolus and make things a bit easier to swallow. So in place of an egg and cheese on English, scrambled eggs with cottage cheese for moisture and a soft fruit like an avocado could be an option. And here, chicken noodle soup might be easier than that chicken breast due to its moisture content. Next, we recommend fortifying meals with what we call calorie boosters, often dietary sources of fat that provide a lot of calories in a small volume. So this might look like adding that avocado to eggs in the morning. A half avocado is going to provide an extra 160 calories. Adding extra mayonnaise to tuna, egg, or chicken salad. Adding extra peanut butter on the order of 30 calories per teaspoon. Olive oil is an awesome addition to any soup or broth that's going to provide 120 calories per tablespoon. And finally, if someone is able to tolerate full-fat dairy products, we do recommend going that route because they'll typically provide an extra 30 to 90 calories per serving compared to a non-fat or low-fat alternative. For some, drinking liquids may be easiest. Again, we're always going to defer to the SLP recommendations, but if someone is able to safely consume liquids, choosing a high-calorie, high-protein, drinkable yogurt, kefir, or protein shake from the grocery store shelf is a great way to go. There are also commercial oral nutrition supplements like the classic Boost, Ensure, Kate Farms, and Orgain products, and these are typically available in both whey protein and plant-based varieties. In terms of other interventions, if pain is the primary barrier, we want to make sure people are treating their pain as directed by their treatment team. So some patients will receive a prescription for a topical anesthetic like lidocaine. Others may be on a specific pain regimen that could include opioids or another pain medication. And it's important people take these exactly as prescribed by their doctor. If SLP does advise patients to consume thick liquids, they may want to try a commercial thickener, such as Simply Thick, Thick and Right. There are a lot of different options out there. And these are similar to a cornstarch that someone might add to make a slurry while cooking. They can be added to really any liquid to achieve the desired consistency, and there will be specific directions on the container to help people achieve the recommended texture. To wrap up, we'll share a few practical tips and tricks. Here's a snapshot of a typical day for a patient who has painful swallowing. So this might look like treating pain with either topical anesthetics or the pain regimen prescribed by the treatment team prior to eating, and then choosing something that's soft, moist, high calorie, and high protein as ordered by SLP. So some modifications to that may be necessary depending on the individual patient's clinical picture. We do recommend eating frequently to take the pressure off of any one meal. So this sample day might include cream of wheat with whole milk as that full fat dairy source and a berry compote first thing in the morning. Then a few hours later, a cup of lentil soup with olive oil for fortification, a drinkable yogurt in the afternoon, shepherd's pie, which should be a good source of calories, protein, moisture, and some fiber if there's some good vegetables in there, and then perhaps some ice cream with a soft banana in the evening before bed. Every patient is different, so we do encourage patients of the Mass General Brigham Cancer Institute to schedule appointments with our team of dietitians by requesting a referral from their oncology team. And we're currently able to see patients in Boston, Danvers, Newton Wellesley, and Waltham. Here are our references, and we'd be happy to take any questions.
Awesome. Thank you so much, Martha. I think that was a really incredible overview. I think that oftentimes when we think about managing challenges to swallowing in context of treatment, it's a balance of what's safe and thinking about avoiding food going into the lungs and risk for aspiration and pneumonia, and then also considering what's tolerable. So between pain and discomfort with swallowing associated with treatment, our team is often trying to help patients, even if swallowing is safe, swallow enough to maintain their nutrition. So I think you really outlined those really well. All right, so looking to the chat, the first question in here is, can you provide information on kefir and its nutritional benefits? And do you want to take a stab at that, Martha?
Absolutely. So kefir is like a drinkable form of yogurt, good source of calories and protein, and it has some probiotics in there as well. I would say the one potential edge that kefir has over a classic yogurt is it may have an increased diversity of probiotic strains. So from a gut health standpoint, always a good option. It's going to probably be a little lower in protein than like a Greek yogurt, but the Greek yogurt is thicker. So, as tolerated, both could be really good options to include.
Awesome, thank you. And I think a question that I would add is, how do you go about talking to patients about kind of diet diversity when swallowing poses a barrier to kind of including foods that they might otherwise want to include? So if swallowing things like raw fruits and vegetables or some of the like more texturally challenging foods isn't something that they can do during treatment, do you worry about patients including a broad array of foods, or is it okay to kind of lean on certain foods for a prolonged period of time?
Yeah, that's a great question. I mean, I would say it definitely depends on the individual patient. In an acute window, if we're looking at a few weeks and someone has a few really well-tolerated foods they're relying on, I wouldn't personally worry too much about the diet diversity. But if we're looking at a longer treatment regimen, and someone's up to making a smoothie or a soup with, fruits and vegetables at home, preparing some purees, or even buying like applesauce, mashed vegetables on the fruit and vegetable side, that could be an option, as well as, we may direct people to try pureeing different meat or fish and adding in gravy and broth for moistures. So all could be options, but I'm curious, Rob, do you have any modifications on that advice?
Yeah, no, I think that's really well said. I tell patients all the time that nutrition is a marathon. What you do over the course of a week or 2 weeks, as long as you're getting enough nutrition to support your immune system, to maintain your body weight, to keep your muscles strong, that's really our priority during the acute phase of treatment. And then if swallowing difficulty persists for a longer period of time, longer than a few weeks into the months, that's when we start to think about nutrition diversity and a variety of plant foods to support like long-term chronologic health. But in the short term, really we're worried about nutrition adequacy. And you can do that with protein shakes and a small handful of soft foods without sacrificing on nutrition diversity. There's no other questions in the chat, so I guess I'll just reemphasize that during this phase of treatment, if swallowing is challenging, it's totally acceptable to lean on packaged protein shakes or smoothies that you can prepare for yourself at home. Listen to your doctor, to your speech language pathologist, and to your dietitian to build a regimen that's nutritionally adequate and safe for you. But don't feel like you need to reinvent the wheel. Some of these products are really excellent and have great nutrition adequacy. Not seeing any other questions, so please feel free to enter them now as we wrap up. But otherwise, I'll pass it back to you, Amy.
Thank you, Rob. Thank you, Martha. While we wait to see if there are any final thoughts or questions anyone would like to share, I'm going to enter in the chat, save the date. Our next webinar is going to be on eating for now and for later, diet guidance for cancer and heart health, in recognition of American Heart Month. And I'm going to enter that in the chat. That's going to be on Monday, February 2nd, also at noon. I provided a link to the Blum Center website, and there you can get more information on the next webinar, as well as the upcoming webinars that we have scheduled throughout the year until I believe May or June. And you'll be able to find the Zoom links in there as well.
Awesome. Thank you.
Thank you. And for anyone who joined us a little bit into a couple minutes into the program, I did mention earlier on that this session is being recorded. So if you're interested in viewing the recording, as well as any of the past sessions, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Once you click there, there's like a rectangular button that says watch past webinars. And from there, you can access all the recordings. All right, so I don't believe we have any additional questions, so I think it's okay to end a few minutes early.
Awesome.
Rob,
Thanks so much.
Martha, thank you again, and we hope to see you all next month.
Thanks, Amy.
Take care.